So we're going to continue about the Leukoplakia. So in this video, we'll talk about the histological features as well as some treatments of Leukoplakia. So let's get started. Now let's see the histological features. So there is change in keratinization. So in stratum corneum layer, the keratinization layer is changed. So leukoplakia generally undergoes hyperorthokeratinization or hyperparakeratinization. So hyperorthokeratinization is the condition where the cells are dead and also the nucleus are completely lost in the stratum corneum layer. So while the parakeratinization is the condition where the cells are dead but the nucleus is still retained. As you can see in the picture, this is the parakeratinization. So the purple stained colors, they are all nucleus that is stained by the hematoxylin, and you can see they are still present in the stratum corneum, the purple stained color. These are all nucleus, so they are still present. This is the parakeratinization, although the cells are dead. While in orthokeratinization, the cells are dead, but and also the nucleus are completely lost in the stratum corneum layer. So this is the orthokeratinization. So in histological features, leukoplakia either undergoes hyperorthokeratinization or hyperparakeratinization. Also, there is change in cellular layer. So initially there is a cellular atypia, so the cells become irregular, and later epithelial dysplasia, so later the whole layer of the cells changes. And also there is a cellular pleomorphism, that means the shape sizes changes. As you can see here in the picture, some of the shape and sizes are changed from their normal structure. So this is the cellular pleomorphism. And also there is an increase in nuclear cytoplasmic ratio. So in the normal cell there is a less portion of the nucleus and large portion of cytoplasmic, but in some cells there is more portion of the nucleus, as in here, and less portion of cytoplasmic. So the nuclear portion increases and the cytoplasmic decreases. And also there is an increase in mitotic figures. So the mitotic activity increases and the cell number also increases. And there is a drop shaped rete ridges or pegs. So these are the rete ridges or pegs. So if you see this shape, this become drop shape, so it resemble to the water drop shape. And also there is a basal cell hyperplasia. So if you see the basal layer, the last layer, their number increases rapidly and they undergoes hyperplasia. As you can see, there is also change in epithelium. The epithelium either undergoes atrophy or acanthosis. So acanthosis means there is an increase in layer of stratum spinosum. So you can see here in the picture, there is acanthosis in the stratum spinosum. So the layer of the stratum spinosum increases. Also, there is alternation in the underlying connective tissue. So there is a destruction of collagen fibers, and there is a chronic inflammatory cells infiltration, such as plasma cells, lymphocytes. Let's see the differential diagnosis of leukoplakia. So here are the list of diseases that resemble with the leukoplakia. So the lichen planus. This lichen planus usually occur bilaterally on the both side. So while the leukoplakia, it can occur either on the one side or both side. And the frictional keratosis. So frictional keratosis is usually caused due to the friction or grinding or maybe biting, while the leukoplakia, it is mostly caused by smoking. Also candidiasis. So candidiasis, the white lesion can be easily wiped off, and if you wipe, there is a red ulcers beneath the white layer. While in the leukoplakia, the white layer cannot be scraped off or removed easily. And the leukodema. So in leukoedema, there is a white layer and it easily fade away if it stretch the cheeks or the area, while the on the leukoplakia, the white stuff does not disappear even if we stretch our cheeks. Also, it could be caused by the chemical burns. I mean, it could be resembled with the chemical burns. So in chemical burns, there is a pain, while in the leukoplakia the pain is not usually present. Let's see the treatment of leukoplakia. So the first treatment is removal of causative agents such as alcohol, cigarettes, smoking, betel nuts. So these are the main stuff that causes leukoplakia, and these habits needs to be stopped. Also, maintaining dietary levels such as vitamin A, vitamin C, vitamin E, beta carotene. So the vitamin levels should be optimum as possible. And we can also treat by the medical such as retinoids. So these retinoids are the vitamin A derivatives. So vitamin A it inhibit the replication of Epstein-Barr virus, as Epstein-Barr virus contribute to the leukoplakia. So this vitamin A inhibit the replication of Epstein-Barr virus. Also podophyllum can be used. So podophyllum, it is the solution that is made from the roots of the plant is called May apple, and this solution it heals the leukoplakia paths, but it can also causes discomfort and affect taste. Also, tropical bleomycin can be used. So bleomycin is normally used to treat cancer. And in the systemic medication, we can use beta carotene 150,000 international unit twice per week for 6 months. Also, vitamin A derivatives can be used, and combination of beta carotenes and vitamin A also can be used, or combination of beta carotene with vitamin C and vitamin E can be also used per day for 9 months. And in the surgical method, surgical stripping is done. So with the help of surgical instrument, the white patch is removed. Also fulgation with electrocautery, so you can remove with the electrocautery too. And also chirosurgery is done. It is the process in which the cells are frozen and the excision is done.